Hey, my friends. Oh my gosh, this was so unfortunate. I was trying to hello. It's Thursday, and I was trying to go onto my laptop to um to have the conversation, and for some reason the microphone isn't working. I'm sure it's user error. I'm so sure, but I couldn't figure it out. I couldn't figure it out. So, um, I couldn't wait any longer. I needed to come on. So my apologies for just coming in now and for using my phone. I don't like to use my phone for the Radiant Wrap sessions. I'd rather be on my laptop. But like I said, it's probably, hey, my friend, how are you, Miss Sheila? Like I said, hi, how are you, teacher Jennifer? Miss you. Um, yeah, I wanted to talk about reversing high blood pressure and diabetes part two, because last week I talked about blood pressure. It's a lot of information. I am no doctor. Don't try to be. I love being on the preventative side of health and wellness, but there are certain things that we really, really need to know. And again, my apologies. I don't know what's going on with my laptop. I'm sure it's user error. But on Thursdays, I do like to come on and share a little bit with you, all things that I believe we need to be healthy and whole. And they are in the acronym RADIANT, like rest, activity awareness, diet, introspection, agua, that hydration is really needed, and I said, and training, because we need to train our bodies and our minds. So last week we spoke about the blood pressure, and I said, well, let me leave the diabetes part of it for this week. And even then, still, it's a lot to try to talk about in just a few minutes, 10, 15 minutes. But the basically diabetes is, it affects how our body turns our food into energy. And there's a hormone that we have that does that, and that is insulin. It's supposed to. And when it doesn't produce the insulin, or our body doesn't respond well, then we have a problem. It doesn't metabolize the carbohydrates that we take in, and then we have too much of this blood sugar or glucose in our blood and urine. And the consequences are pretty horrible, because you can have heart disease, you can have nerve damage, you can have vision loss, kidney disease is a big one, feet problems, oral problems, and even our mental health is impacted. So it's important that we pay attention. Now, one of the things that I find that can be confusing, there's two ways of measuring this blood sugar level. When you fast, you have to take a test. That's the only way you know. And so one of the measurements is through milligrams per deciliter. That's just the measurement. And you want that number to be between 70 and 100. That would be normal. If it's anything like above that, between 100 and 125, that's pre-diabetic. So you may hear it expressed like that. Well, there's another measurement that sometimes use millimoles. And millimoles, you'll hear it said 5.6. So anything around 5.6 is normal. Between 5.6 and 6.9, if you hear that type of number, then you know you're pre-diabetic. And anything over that 126 or 7, sometimes you hear the number 7. Usually it's two. I think it's two tests you have to have, two separate times where you get a number 7, and then you'll be diabetic. But let me tell you this, it is preventable, or reversible in most cases. Now, the symptoms that you're going to have typically, if you have them, are you urinate a lot, especially at night. You're thirsty. You can lose weight. So, I mean, in this case, that's not a good thing, okay? Without trying. You might be hungry. You might have blurry vision, numbness or tingling in your fingers and hands. You may be tired. Your skin might be really dry. Just certain things, you might have some of those things going on. There's different types of diabetes. Type 1 is typically, not always, but typically it will happen at a younger age, like as a child. And this one is really one that you can't prevent. They don't even know why you get type 1 diabetes, and they think that it's affected by our immune system. And age and genetics are factors, is pretty much what we know about that. So if that is the type of diabetes that you have, we're not really talking about that one so much. We're talking about the type 2. There's a gestational diabetes too that you get when you're pregnant, and there's not a whole lot of factors. You just have a test for that one too. Although I don't know why, maybe it's the motherly part of me. I've been able to, I think, tell a lot of times if expecting mom has gestational diabetes. But like, again, I'm no doctor, right? Make sure you go see your doctor. Type 2 diabetes is the one where it is most preventable. And guess what? If you have gestational diabetes, you're more at risk of developing type 2 diabetes, okay? You're at risk if you've had that. You're at risk if you're pre-diabetic. So if those tests come back between 100 and 126, you're at risk if you're overweight. If you're older, like 45 years or of age or older, you're more at risk. But unfortunately, more and more of our children and our teens are being diagnosed as pre-diabetic and diabetic. If you have a parent or sibling that has type 2 diabetes, you are more at risk. And if you are not physically active at least like 3 times a week, I think that's the number in the CDC, you are more at risk of having diabetes. And so, if you are a person of color, you're more at risk for diabetes. I don't know to how that breaks out, socioeconomical, conditions and things like that, but genetically, Hispanic, Latino, Asian, African American, you're more at risk for diabetes. Yes. And so we talked about the symptoms. We were talking about let me talk about a little bit about, before we go, how it's preventable, and why it's not too late. So we used our, why it's not too late. Even if you have diabetes, even if you're, okay, I already have it, I'm older, so what difference does it make? I'm already dealing with all of these things, and at my age, it's not going to be a whole lot that I can do. I already, lost a limb, whatever has happened. It's taken its toll on your life. Because you're still here, my friend, because you're still here, because you can be an inspiration for someone else, a neighbor, a grandchild, or great-grandchild, right? You can stop the cycle, that generational, perpetual thing. Like we can't just oh well, my parents had it, my grandparents had it. Oh well, I'm doomed for it. No, these are not necessarily the truth. Definitely not. Our diet impacts whether or not our risks are higher for pre-diabetes and diabetes. Physical activity impacts it. So our lifestyle impacts type 2 diabetes. And so what can we do? And what can we do that is sustainable, measurable, attainable, relevant, and time-based? We can take any of those things, looking at how I can eat, how I can be healthier, how I can eat healthier, how I can move more. Any of those things, let's say, because I think a lot of times we think we have to do a whole lot of exercise and then eat like crazy and take the medication and then we're good. And I'm not knocking the medication. It's there for a reason. God gave us chemists to make medications for people that need it. However, the natural chemicals, medications that we should first look to is food. Food is medicine. Food is medicine. Look at how you can remove some sugar out of your diet. You're drinking 2, 3 Cokes a day. Can you cut it down to 2? Start small somewhere. You know what I'm saying? Can you stop smoking? That's another factor. Can you stop smoking? Can you decrease the amount of cigarettes that you are taking? It's expensive anyways. And so is being sick. It's expensive to be sick. A lot of times we'll look at, well, to be healthy is expensive. Well, what's the cost of losing a limb, of being on dialysis? I mean, it's no bueno. It's no fun to lose our health when we can do things about it. If we can help, help me to help you, help your spouse to help you, help your sibling to help you, help, whoever the loved one is to help you by doing your part in taking care of yourself. And taking care of yourself now, you see, I know you have examples around you where you see what wrecking your body can do. Being sedentary, not just eating anything you want, and not adhering to the signs of being unhealthy. So I'm rambling, so I'm going to go. I don't see any questions in there. I just wanted to, but if you have questions, you can always put them in the chat. You know that you can always message me privately. I am here for you. Okay. Yes, I remember you took a class at the Y and you did very well. And it was required to get 150 minutes of exercise and watch your fat grams. Hey, Julian, how are you? Interesting that you were required to watch your fat grams. A lot of times I think, fat intake can be the culprit. It's also sugar that can be a culprit, like the amount of carbohydrates that turn to sugar in your body. So it's not necessarily just fat. Eating more vegetables is critical. Eating more vegetables, and like you said, Miss Sheila, moving your body is critical. So how is it today? Ms. Sheila. How are you doing today? I encourage you all, yes, to look for like a diabetes prevention course, or just even taking some of the information that I shared with you today and making it a commitment that you're going to do better. Make a commitment that you're going to do better so that you can best care for those that you love. Woohoo! A1C is 5.7, so that's right in between those numbers that I shared. So that's very good, Miss Sheila. Keep up the good work, my friend. I love you. There's nothing you can do about it. I want us to not just be here and live, but live well. What, we can live for the last 20, 30 years of our lives sick. Now, there are some that, are going through, and there are certain things that they can't do anything about it. Believe me, I'm not talking to you. The majority of us, there are things that we can do to be healthier and to prevent type 2 diabetes and or pre-diabetic, becoming pre-diabetic. All right, my friends. Bye.